4,400 people. That was the attendance at this year's Medicarians conference in Las Vegas. The 4,400 of the most boring people across the country came to Vegas and talked about insurance, Medicare, the Affordable Care Act, group benefits, and industry trends with healthcare and all things insurance. And it was fantastic. And I'm here today to share some of the takeaways that I had from that conference. My name is Colin Wattenville. I own an insurance agency based out of Omaha, Nebraska that specializes and focuses on all things health insurance. I personally helped over 1,000 people with their Medicare health insurance for their family or themselves, and also businesses with their employee benefits over the 8 years that I've been in the industry so far. And I am always trying to expand my mind. Even 8 years in, there's always different situations that I come across that are new and I haven't seen yet, as well as an ever-changing industry based off of politics and new laws and legislations. So that was why I try to go to these insurance conferences, these national insurance conferences, to expand my mind, step out of my comfort zone a little bit, and of course, learn a lot. Hear about industry trends, new changes coming down the pipeline, potential legislation impacting our industry and consumers as well. So I'm here to talk about some of the things that I learned at the most recent conference that I went to, again, which was Medicarians in Las Vegas. And I know what you're thinking. Insurance, especially health insurance and Medicare, combined with Vegas, that just doesn't seem like it fits. But let me assure you, it was a lot of fun. And not only did you learn a lot, but you actually had some downtime to go explore the city. And of course, they throw some very killer after parties and all sorts of stuff. So first and foremost, despite the name of this conference, Medicarians, it was actually not just about Medicare. It was an all-encompassing conference for health insurance. So they had separate tracks you could go down, separate breakout sessions basically. And there was kind of 3 or 4 main ones. You had one obviously geared more towards Medicare. You had another geared more towards the under 65 side of health insurance. So a lot of talks about employee benefits and the health insurance marketplace, Affordable Care Act plans, all that. As well as they had kind of another separate track focusing more on money. So it was also a good conference for financial advisors probably, because there's a lot of talk about life insurance, long-term care planning, safe money vehicles for seniors, especially in volatile times such as we are in now with the stock market. A lot of talks about annuities and some different options to keep people's money safe during volatility. So it was a very interesting conference. I didn't know what to expect. I didn't know if it was just going to be focused on Medicare because of the name, and I was pleasantly surprised that it was more encompassing than just one of the areas that I deal with every day for helping consumers. So a couple of key takeaways that I wanted to focus on in this video is actually surrounding the Medicare side of things. I might make a separate video going into the things I learned for the under 65 side or the employee benefit space, but honestly, most of the takeaways and most of the sessions that I went to were about the Medicare industry specifically. So I have some stats pulled up here. In terms of agents and agencies, a hot button topic is senior switching plans. And I say seniors loosely because not everyone who has Medicare is a senior, but just majority of those are. So I'm going to be using the word seniors probably a lot, but you kind of get an inside glance of the numbers behind what makes an insurance agency, what makes an insurance business profitable, because at the end of the day, obviously, we do make money when we help people sign up for a plan. But the way the system is set up, the incentives are there, in my opinion, to make sure we're not technically fiduciaries, but the system and the way payments are processed to insurance agents and agencies makes it so you basically have to be a fiduciary if you want any sort of long-term income in this field. A very well-known agent in the Medicare space, he's super famous nationwide for our industry, but he once said, I think I actually heard him say this at another insurance conference, he said that the best policy for a consumer is the one that they're going to keep the longest. Because if they're going to keep it a long time, That means it fits all their needs. Their prescriptions are covered well. They're able to see the doctors that they care about. Probably has some good extras in there to help make sure they have their eyes, teeth, and ears covered well. Might even have a gym membership for them, things like that. And so the best plan for a consumer is the one they're going to keep the longest. And then by default, the way we get paid, we never charge the consumers for our expertise. We get paid a commission by the insurance company whenever a consumer signs up for one of their plans through us. And so obviously we only get paid if the person signs up for a plan and they stick with that plan. We get paid monthly residuals every month that person has a plan through an insurance company. So naturally, we're going to want to do the right thing for them, for that consumer, and make sure they are in the best plan for them, because the longer they stay in that plan, the happier they are. And then also by default, the longer we're getting paid on them. And so that's the first thing I want to talk about is what's called the lifetime value of a Medicare beneficiary. I know that might seem kind of weird or icky, or just putting a number to a person, but at the end of the day, running an insurance agency is a business. It's a very fulfilling business where you get to help a lot of people with some pretty confusing topics and necessary product that they need. Everyone needs health insurance, right? Several of the breakout sessions at the Medicarians conference was talking about, from an agency owner perspective, from a business standpoint, the profitability of our industry. Is it even worth getting into the insurance space, into the Medicare space, and helping consumers? Is there even any money in it? That was a big change, actually, from a lot of the things I heard from this conference. As of a couple of years ago, the first ever insurance conference I went to, also in Vegas, was people were talking about the lifetime value of a customer. And back then, only a couple of years ago, big agency owners, big insurance companies, they were saying that the lifetime value of a Medicare customer was about $2,000. And fast track to this year, 2025, which they were probably going off of all their recorded data from 2024, since we're only a little over a quarter into the 2025 year. But the lifetime value of a Medicare customer has now dropped from $2,000 down to only $800. So from a business standpoint, if you are going to be marketing towards and trying to accumulate new clients in the Medicare space, you can't be spending as much money anymore if you're not going to be receiving as much money from those customers, right? Not from the customers directly, but from the commissions you're receiving for the plans you set those customers up in. A lot of the decrease in the lifetime value of a customer stems from two things. The biggest thing that changed the lifetime value, that changed the fact of a customer now brings in an agency $800 versus the $2,000 it used to be, was that the rapid amount of plan switching that we're seeing. So seniors, those on Medicare, they're not staying with the same plan for as long as they used to be staying on them. And that's kind of a cause for concern. That indicates a lot of things. That indicates market volatility, meaning these plans are changing a lot. But another thing that people kept mentioning, that the speakers and the presenters would talk about, is these rapid plan switching, where a lot of times people on Medicare are being advertised to in a very deceptive way. A lot of misleading advertisements on YouTube or commercials on TV, on your phone, on social media platforms. There's a lot of bait and switches where these advertisements seem a little too good to be true, or they talk about these elusive flex cards or spending allowances, which I've also made a video on before in the past. And these consumers are getting tricked, putting it bluntly. They're getting tricked to switching plans without really knowing if it's better for them. They're switching plans a lot faster just based off of kind of he said, she said, maybe their neighbor had a good plan, or again, more likely than not, they're just getting taken advantage of or kind of lied to by some of these advertisements. So that's a big reason why we're seeing a decrease in the overall quote unquote value. If you're putting a number to it, the lifetime value of a Medicare customer now is a lot less than it was even 2 years ago. For example, one statistic that really stood out to me that was quite concerning was that 30%, so almost a third of all disenrollments, meaning a customer signed up for a plan previously during an enrollment period or whatever, and then shortly switched to a different plan, maybe the next year or a little bit later, or within the first year even. 30%, so almost a third of those disenrollments, when a customer moves plans, the consumer didn't even know they were switching plans, which is highly, highly concerning, right? And some might think, well, how the heck can that happen? I've had that happen to many clients over the years, unfortunately. Again, that goes back to all the deceptive marketing practices where a consumer might see an ad on television that says, call in to see if you qualify for this flex card or something along those lines. And then they call in and the shady representative, the bad agent, because just like every industry, unfortunately, there's good ones and there's bad actors out there, right? And the bad actors ruin it for all of us good ones, sadly. But the customer will call in, they'll give the rep on the phone, the bad agent, their Medicare number, their address, and their name and date of birth. That's really all you need to enroll someone in one of these Medicare plans, believe it or not. Now you have to read some disclaimers and tell them the call is recorded and get them to sign off on something called a scope of appointment and all that. That can be all done over the phone now and via text and email. So as far as the consumer is concerned, sometimes they don't even know that they're switching plans. They think they're just seeing if they qualify for some of these extra benefits that they're seeing on these deceptive advertisements. So that's very concerning. So with all that happening, all the changes, all the deceptive advertising that's going on in the Medicare space, that's leading to less income per customer for insurance agencies and agents out there. So that was one of the big key takeaways from the Medicarians conference. With all that being said, that is why it is super important to find an agent or a broker, hopefully a local one, or maybe not even local, but one who's done a lot of market research on your area that you live in. That's why it's so imperative to find a good agent that you trust, who has options to shop around many different companies for you and who has your back, right? They're not just working at a call center somewhere who has a quota to hit and they're just trying to sell anybody any plan. Because again, that's what's driving down their retention for consumers. That's what's causing them to switch plans so often, is they think they're getting one thing but then getting baited and switched into something different. Or sometimes they're just being flat out lied to, unfortunately. So finding a good local broker that can help you and who understands your market and the hospital systems around you, as well as your needs, right? The prescriptions, your health needs. Maybe dental is important for you one year, but not so much the next year. So it's important to find someone who's going to fight for you and who stays up to date on all the changes that are happening in the industry. And a lot of people are still trying to shop for their Medicare plans and health insurance in general on their own. And that's crazy to me. I mean, it's a lot for even us agents and us brokers to keep up with, right? There's constant changes legislatively. Carriers are always changing their plans, discontinuing certain plans, updating ways to enroll in plans, bringing new plans to the market, all sorts of changes happening. And so I don't know why anyone would shop on their own for their health insurance anymore, because there are a whole network of brokers out there like myself and my agents who can help you shop a plan, who sit down with you and figure out your specific needs. And we don't charge you anything. Again, we get paid by the insurance companies, and we get paid every month that you stay on the plan we signed you up for. So we're also incentivized to find the best plan for you. So that was really one of the biggest takeaways from the Medicarians conference that I went to recently, was that the consumers are switching plans more often than they ever have been, truthfully. And that should be a red flag. That is a cause for concern. We need to be better about finding the right plan for a consumer and making sure they are educated and that they know why that's the right plan for them, and explain to them to not jump at shiny objects, right? Don't have shiny object syndrome. If something sounds too good to be true, it probably is. If you catch yourself talking on the phone to some random person that you don't know where they're located and you've never met them before, and you're all of a sudden giving them some of your personal information like your Medicare number, that should raise some eyebrows. That should raise a light bulb in your head to make you stop and think, okay, maybe I should find someone who I can see in person, who I can maybe meet with in person, or who I at least know where they're physically located, and hopefully they're located somewhat near me, maybe in my own city or even a couple counties over, maybe even the next state over, right? Because they're still probably familiar with the health systems and all the changes in your market if they're still pretty close to you geographically. So that was probably the biggest takeaway from the insurance conference I went to recently. This video is already long enough, so I'm going to make a separate video actually talking about some of the other takeaways I received from attending But if you are interested in topics like this, Medicare trends, health insurance industry, employee benefits space, anything health insurance or healthcare related, that's what we're here talking about. So give us a like and hit the subscribe button. Follow us on your favorite social media platforms to stay up to date on all things health insurance. Thanks for watching.